This is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So here I would like to give you some tips how to begin your OET speaking because most of the students are making a mistakes when they are beginning the speaking. For example, if the patient is newly to that center or clinic or the hospital, like in a A&E, like accidental emergency department, there it's better to ask, may I know the reason for your visit today? How can I help you today? And what seems to be the problem today? And you can ask, how can I address your problem today? So these all are the way you can address their problem and you can begin your speaking. But in your OET speaking, if in the nurse descriptions they have already given, you have examined, you have assessed, and the history collections are done, in that situation, it's better not to ask, how can I help you today? How can I address you today? What seems to be the problem today? Because it's not a right way of begin your OET speaking. So how can I start that OET speaking in their situations which I have already done the assessment, which I have already completed the history collection, which I have already examined the patient. So in that scenario, before you start your role play, and you have a 3 minutes of preparation time, isn't it? So during that time, it's a good idea to ask the examiner, may I know your name please, and how can I address your name during my role play? So like that, you can just ask your name. So now you can begin. If you have already done with an examination, so how you can begin your speaking? For example, you are talking to a patient, her name is Mary. Okay, hi Mary, I just completed your examination. So based on my examination, I came to know that your wound is red in color and it's swelled. And I would like to ask you one more thing is, do you have a pain? So like that, you can start your role play. You can begin your talk. Okay. And if you finish the history collection, in this situation, how you can begin your OET speaking? So which you have done it already, and now you are going to the further discussion, right? So now here, hi Mary, I just now completed my history collection. So based on my history collection, I came to know that you have been suffering with high blood pressure for the last 5 years. So Mary, could you please tell me, are you compliant with your medications and what kind of the medications that you are taking? So like that, you can begin with your OET speaking. Okay. And now you have completed your examination. So how you can begin with your speaking? So you can start like that. Hi Mary, I just completed my examination on you. So based on my examination, I could say that your wound is red in color and there is foul smell, and also I could see some pus collection. So it is very important to clean the wound at the moment, and I'm going to complete the dressing. So thereby I'm just applying an antibacterial ointment over that area and I'm covered that with the dressing. Is it okay for you, Mary? Like that. So better try not to use, how can I address you? May I confirm your name, please? Instead of that, which you have done it already, just right away enter into the task rather than asking. If it is a new patient, if the scenario and the background is entirely new, so there you can ask, how can I help you? How can I address you? And if it is a hospital ward, you can just start, hi Michael, how are you doing today? And how are you feeling now? How can I help you today? Like that, you can just ask the patient rather than you are just, hi Michael, I'm your nurse and I'm going to taking care of you today, and may I know your confirm your name please? So just better not to do that because it is consuming a lot of time in your OET role play. So you have only 5 minutes. So in that situation, please read the background properly. Based on the background, always initiate the conversation that will help you to complete your conversation within the time period, and also you can use your time effectively. Okay, I hope this video will help you all, whomever is preparing for their January exam. And we are running our 30 days class, 20 days and 15 days mock batch, and only for writing and speaking. Separately we are doing a classes for writing and for only speaking, and beginners batch is also running. Whomever wants to join in our class, you can contact us at any time. Our number has given in our description. So until then, bye bye.